Hello, my name is George Wanamaker, and this is a continuing series on back care and maintenance. What I'd like to talk about today is a topic that I've talked about before, but I'm just going to review because a lot of a lot of people have asked me to review it again, and just to give a little bit more context and detail to what may be happening. And that topic is sciatica. Sciatica is a word that gets thrown around a lot. You might have pain and go to the doctor and they say, "Oh, you got sciatica," or you might be talking to one of your friends and they say, "Well, my sciatica is acting up." What does that mean? Like, what what exactly does sciatica entail? So this is going to be just a general overview of what is sciatica, and then I'll probably finish up with just some very gentle ideas for stretching and considerations to do about sciatica. So I'm trying a new format here just to see so you can have some context about what I'm talking about. So sciatica. Um, Sciatica especially has to deal with there's a nerve or a group of nerves running down the back of your hip, your pelvis, and your leg, um, called the sciatic nerve. So essentially, your this is a picture that this is obviously a person where basically here is the spinal cord with all the representations of nerves coming out either side. Um, but the nice thing about this picture is this is the spinal cord without the bones on top. So this is deep underneath what would be, you'd have bones layered around this to provide a protective structure because this is soft tissue. This on its own, your spinal cord doesn't have much structure or rigidity. It's intact and it's a continuous piece, but it doesn't have the same rigidity that bone has. So this is not bone. This is all nervous system tissue from starting from your brain and going all the way down, supplying your muscles, your organs, everything. So, but this down here towards the lower part of your back, there's the nerves that come out from either side of your spine, and they form a little bundle down here in your pelvis and particularly in your buttocks region. They form a bundle called the sciatic nerve, which is a pretty thick nerve. It's probably, oh, maybe not quite the length of your index finger, or not the length, but the width. But it's still pretty thick. Probably a good analogy would be like pencil thickness or something like that. So it's a pretty thick piece of tissue. That may be exaggerating a little bit, but it's visible. It's tough in itself, and it's a collection of a bunch of nerve root bundles coming together to form a big thick nerve. And that nerve runs down the back of your hip, the back of your pelvis, down the back of your leg, and branches off to supply different muscles and different elements of your body. This is a good picture because it shows this the end of the actual spinal cord and then the branching off, and you can't really see here because it's sort of transparent, but you can see your pelvis, and then then your nerves are coming together to form the actual sciatic nerve. So why is this important? This is important because this bundle of nerves here is en route to a bunch of important structures, musculature, pain receptors. There's a bunch of different tissues that are affected by this bundle. And if it's getting pushed on, whether it's in the spinal level higher up or whether it's down here in the hip, it can present with what people consider as sciatica, is either pain in the low back, the back part of the pelvis, or down the back of your leg. When people say, "Oh, my sciatica is acting up," they're usually referring to this trait that somewhere in the river down here is getting pushed on or getting compressed or getting short-circuited. So I've borrowed a bunch of other pictures from Google. This is another picture that essentially up here, higher up, you can see that there's multiple nerve roots that are coming together to form this big nerve wire, for lack of a better representation. Unfortunately, this picture is kind of blurry, but this picture also shows some causes, some things that can cause sciatica, those symptoms. What's confusing about the term sciatica is it can originate in different areas. And when you're having those symptoms, the symptoms of pain in the back of your leg, you really need to consult your doctor because it can be from different sources. There's not exactly a one-all treatment. It really needs to be tested and diagnosed further to figure out what is the true source of my symptoms. Meaning that, like in this picture, this person has a bulging or herniated disc, and the disc is pushing on the nerves, which is higher up in the back. This is actually in the spinal structure that could be originating these symptoms down the back of the leg. So keep that in context, because what can also happen is lower down in the pelvis, there are a couple muscles that are closely associated with that nerve, meaning that the sciatic nerve right here, as you can see, it's this big, thick yellow piece, has to go right underneath a particular muscle called the piriformis muscle, which is commonly a culprit. There's also another group of muscles here that are closely associated with this, but for generalization's sake, the piriformis muscle, because it is so closely touching the sciatic nerve, if this piriformis muscle is tight or compromised in any way, it can put pressure up on the nerve, which then you can have that pain symptoms down. Now, this is a cause of sciatica in your pelvis, versus what we just talked about was this is the herniated disc or a bulging disc can cause symptoms higher up in the back, which is why I'm saying if you're having these symptoms, you need to go talk to a doctor so they can do testing and figure out what is the true cause of these symptoms, because the origin can be in different places. Some people, a genetic set of people, are even predisposed to have this condition, because it's rare, but it does occur. This piriformis nerve is actually pierced or grown through, or this sciatic nerve can be grown through this piriformis muscle. And these people tend to have chronic pain. They respond to stretching, but they're probably always going to have some degree of this problem if they don't maintain their body, maintain their weight, maintain their tissue elasticity. You would have to have a special imaging to know this, or you really wouldn't know unless you had deep diagnostic testing. But there is a select few of the population who this nerve is actually through this muscle. That's very rare, but it does occur. So what about all this? By now, you hopefully have a better understanding of sciatica is in relation to this big nerve that's getting pushed on, that originates from your back, from a group of nerves that come together to form this big telephone wire type structure that goes down the back of your leg. What can be done about this? Well, there's some that can be done about it. Typically, the route is daily stretching. There's a particular set of stretches that we recommend. Also, stretching, especially after prolonged sitting or first thing in the morning when you're just waking up. My patients that I see, I commonly find that they'll say, oh, I have just pain and pain when I've been, sitting for a long period of time and get up, it's like I can't walk. Or, if I've been standing for too long in one place, like it runs down the back of my leg. Or when I wake up in the morning and I first get up, there's just this pain down the back of my leg. Well, a lot of that is due to your spine, that your spine is in an extended position, is not allowing space for these nerves higher up to be more free so they can send their signal. But it also too can be because of your tissue elasticity. Your tissue elasticity meaning your muscles, your tendons, everything needs to be stretched. Your soft tissue has a natural amount of elasticity, and it needs to be gone through its regular motion to maintain that elasticity. If it doesn't, it can become more brittle, it can become less stretchy, so your muscles can't do what they need to do, and your spine is more flexed, and you're not able to maintain your posture as well, thus potentially contributing to some of these nerve structures getting pushed on because you can't maintain your posture. So things to do would be to first thing in the morning, stretch, move your legs, stretch, bend your knees, try to straighten your legs. You can search, or if you have any questions, there's a lot of resource material available about doing glute stretch. Glute stretch being stretching the big muscles in the back of your hips, and then hamstring stretching, which are the muscles attaching from the bottom of your pelvis down to your knee. And I'll demonstrate a few of these in a second. But just having general good flexible mobility, especially when you've been sitting for a while or first thing in the morning. So let's talk about some stretching you can do. And I'm going to get in a position to where hopefully you'll be able to see me. So let's talk about a hamstring stretch. So the hamstrings attach at the bottom of your pelvis and go all the way to the back of your knee. A way to stretch it in sitting would be to have one foot extended, side. 1 foot extended. You want to put some tension on your nerves by bringing your toes back if able. Have your hands on the sides of your hips, and then gently lean forward with your legs straight until you feel some tension in the back of your leg. This would be good if you've been sitting for a while. Say you went and saw a movie, or you've been at dinner for a while and you're about to get up. Just do a couple stretches, about 30 seconds or so, a couple times. So I'm not bending at my top, I'm trying to bend at my waist. And I feel some stretching in the back of my leg. You can do the other side too. So just hold for about 30 seconds or so. And then relax. So you might say, well, why would I want to stretch the muscles in the back of my leg? My problem is in my back, isn't it? Well, yes and no. It could be that the muscles in your legs don't have enough extensibility, that they're pulling on your pelvis and pulling on your hip and pulling on your back, which then is putting a lot of pressure on those nerve structures higher up. And right here, if you don't stretch some of these muscles that are closely associated with your hip and your pelvis, they could be pushing directly on the sciatic nerve. There's a couple of other stretches you can do. There's one that is commonly referred to as the piriformis stretch, which you can't exactly isolate this muscle, but based on the anatomy of your hip and the alignment of your hip, you can target it a little bit. So I'll demonstrate that. This is in physical therapy, we commonly call this the piriformis stretch. So I'll show it in a second. What you're going to do is you're going to put one ankle on the opposite knee, and then you're going to pull your knee towards your opposite shoulder. So I'll demonstrate. Let me get the camera down. Okay, so I'm trying to stretch my right side. My right and your left, but I'm putting one leg over the other leg, and then I'm gonna pull. Let's get the camera. I'm gonna pull my knee sort of towards my opposite shoulder. So you're going up and then kind of over, and you should feel a stretch sort of in the bottom of your hip. And same thing, I'm holding for about 30 seconds or so, doing a couple times. And then you can do the other one. So yeah, I feel it kind of in the back here. If you can't get in that position, something that works sometimes, if you put your ankle on your opposite knee and then try to slide it up and then pull, like I still feel it a little bit here. So that was putting ankle and then sliding as much as you can and then pulling. So the key there is that you're putting your ankle on your opposite knee, you're pulling your knee towards your opposite shoulder until you feel a stretch kind of in your butt area. Again, you can't exactly isolate these little muscles, but based on the alignment of your hip and your pelvis, you can target it a little bit, enough to relieve some pressure. Another one that I'll show you is commonly referred to in the physical therapy world as the glute stretch. There's a couple of ways to do this. I find that if you push down from your hands and then lean forward, that gives a little bit better stretch, but I'll demonstrate. So same thing, you're gonna put one leg on the opposite leg. This one, instead of pulling up, you're gonna push down and lean forward. So I'm trying to straighten my leg out a little bit, if you can see that. And then I'm leaning forward until I feel a stretch. It's more in the low back pelvis area. So hopefully that gives you a relatively easy, not necessarily routine, but some ideas of some stretching that can be done to help loosen up some of these muscular structures. Some other things to consider are, if you're having pain when you're standing, looking at your posture. Is your posture flexed? Should you be using a cane? Should you be using a walker? You might find that if you're trying to not use a cane or a walker and you really need one, whether it's for cosmetic reasons, like you don't want to be seen with a cane or a walker, which is actually unfortunately very common, or it's just you don't have the availability of one, you might want to consider trying to locate one. Churches are usually a good resource for canes and walkers, they can disperse to people, or sometimes insurance pays for them. But you want to think about posture. Posture is a really, really important aspect of our whole bodies. Even not even all the muscles and the nerves, but also vital stuff like your heart rate, your vital organs, your breathing. They need your body in full upright posture to operate efficiently and as they're designed. And if you're more flexed, whether it's because of pain or whether it's because you don't have the strength or the balance you used to, you're compromising your blood flow, you're compromising your organs' ability to do what they're designed to do. So posture is essential. So that's why I'm saying, if you need a cane, if you need a walker and you're not using one, it's in your best interest for longevity and for improving your nerve conduction, improving the ability for your muscles and your organs to operate, to use a cane or a walker to make sure your posture is upright more. What you'll probably find is that if you're using it correctly, you may have some relief of some of these symptoms. So again, this is about sciatica and specifically. I'll do another review, another session regarding some exercises and particular activities you can do for low back pain, sciatica. But this is just a general overview of what is it? What is the anatomy? I'm having pain in the back of my leg. Why? And how you really should, if you're having pain in the back of your leg, you really shouldn't put it off. You should go consult a doctor because it could be coming from one or multiple different sources that need to be investigated further to find out where exactly they could be coming from. So that's all I want to talk about today. Again, this is about sciatica and specifically about how the nerves could be getting pushed on somewhere in the chain, contributing to these pain down the back of your leg. Again, my name is George Wanamaker. I'm a physical therapist, and this is a continuing series on back care and maintenance. Thank you.